Okay. Hello, and this is the PUGS Innovation Opportunities, and we're doing streamlining procedural case practices. It was noticed that in an interventional radiology, physicians and radiology techs identified that a specific procedural time and safety concern existed for a liver chemotherapy procedure. Specifically, it's called chemospheres or theraspheres. Um, During a procedure, an incident occurred where chemotherapy drugs contaminated multiple procedural rooms, leading to extensive delays. And this was through multiple crossovers and a breakdown of communication when a tech assumed what was flush for the chemo line was actually the chemo itself when she tapped to clear air bubbles. This led to the chemospheres sticking to the director's shoe covering, from whence he then tracked to 3 of our 4 procedural rooms. This led to the closing of those rooms for the remainder of the day, and the patient, the 2 rad techs, and the doctor being held in the room for up to an hour until clearance by the radiology lab tech. So due to the severity of this one-time incident, this had never, Lean or Six Sigma procedures had never been brought into interventional radiology. So no prior efforts had been implemented previously to change our processes. So, because they had seemed efficient up to that point. So with this coming about, it prompted the immediate attention that was needed to see where a breakdown occurred and what could be streamlined.
Okay, well, the system or the principle that they used was lean, and lean is identified with 5 different principles. The first one being identifying the value. So for this particular issue, coming up with a solution would increase patient safety during chemo-specific procedures. And as you'll see in later slides, it also cut down on procedural times. So map value stream, a team of the lean team came in and constructed a diagram of each involved staff member so that they could track their workflow, their steps, and basically the route that they took during the procedure. So the third is creating a flow, and the flow was created by using all the data that was gathered with the map value stream and knowing the value that they wanted to bring. So with that information, they were able to reduce redundancy and procedure time. Number 4, establish pool, which talks a lot about, the principle itself talks a lot about visual cues and efficiency. So the equipment and the carts were organized in an efficient way that improved efficiency. And the cart was organized in a logical way. So number 5, continue to improve. The way that they achieved this was just continuously addressing patient safety and efficiency.
So based on this initial lean solution, some additional techniques can be employed going forward. So this had a positive outcome. Nearly 3 minutes of procedure time were eliminated from each case, which is great. Patient safety was improved, efficiency was improved, but there was a lack of consultation with the procedure nurses, the radiology technologists, the clinicians that were actually doing the procedures. And so without this communication, an effort was made to increase the number of cases scheduled and completed per day. Now, this was not possible due to the additional needs outside of the procedures. For example, recovery time. Each patient required extensive recovery time after each procedure, just based on patient safety requirements. the physical space that was available. So there's a limited number of holding bays. And 3 minutes is great, but 3 minutes of procedure time being eliminated does not equal extra cases being on the schedule. It just wasn't going to work out. So in the future, it would be helpful to utilize several innovation competencies like risk management, interdisciplinary teamwork, cross-disciplinary knowledge, and understanding healthcare systems to improve upon this collaboration and improve the communication skills that we're lacking. It would be necessary to have this direct communication between management and the people who are implementing these new policies and trying to add more cases onto the schedule. And those people need to communicate with those who are actually performing and assisting with the procedures so that things logically make sense in the real world and can be completed safely. And utilizing a value-based healthcare system would also lead to higher patient satisfaction and improved safety. So instead of focusing on volume, as many cases as you can get done in a single day, focusing on value-based. So focusing on each individual patient, making sure that their care is delivered well and without patient safety risks. And based on the textbook, which is cited below, the nursing and healthcare literature is replete with evidence and opinions about the need for interdisciplinary collaboration to ensure optimal patient outcomes, professional role satisfaction, and healthcare excellence. And we think that that is highlighted in this situation that we just described. I don't know how to stop recording. We can edit this part out. Oh, there we go.